Hi, my name is Laura Zatella, and I am a nurse practitioner at the University of California, San Francisco, and also a member of the Medical Advisory Board for the CLL Society. And we are coming here virtually from ASH 2023. And I'm really pleased to be joined by Dr. Lindsey Roeker, who is the CLL Program Director at Memorial Sloan Kettering, and presented an abstract that she would like to share with us today. Welcome, Dr. Roeker.
Thanks so much, Laura. So today I wanted to talk to you about the phase 1b data from Bruin. So Bruin was a clinical trial that looked at Pirtobrutinib, which has recently been FDA approved for CLL. And this was the study that first basically looked at how effective is that medicine and how safe is it. And built into the Bruin study, there was a subset study. Basically, it's called a phase 1b study, where we look at the safety of the combination of Pirtobrutinib with Venetoclax. And then there was also a combination of Pirtobrutinib with Venetoclax with Rituximab. So there was this group of patients who received 2 medicines and the group of patients who received 3 medicines. And the overall number of patients that were treated in this study was relatively low. So it was 15 who got the 2 medicines, the Pirtobrutinib and Venetoclax. It was 10 patients who received the 3 medicines. But the idea here was really, let's make sure that these medications used in combination are safe. All the patients in the study had CLL that had come back. So it was a relapse refractory group of people, meaning that their disease had been treated before, was now back and needed to be treated. Patients were able to have been treated with a prior covalent BTK inhibitor, so ibrutinib, acalabrutinib, zanubrutinib, but they could not have received Venetoclax. So all of these patients did not have Venetoclax before, and they were receiving these combinations. And overall, the group of people who received these medications were young and healthy, and we know that a lot of them, about 2 or 3/4, had their prior BTK inhibitor stopped because of progression of disease. So there was a small subset of patients who hadn't been able to stay on their covalent BTK inhibitor because of side effects, but most of them had their disease come back while on a BTK inhibitor. And overall, this combination is incredibly effective. So the overall response rate for all of these combinations together is 96%. Super, super effective. The CLL cells respond well to the therapy. It works to induce kind of these deep responses. And we even looked at undetectable minimal residual disease. So how deeply are people able to respond to this therapy? And with the combination of medicines, 71% achieved undetectable MRD at a level of 10 to the -4. So we know that the combination is effective at getting rid of the disease. We see very deep responses. And in terms of how long people are able to stay on this medication without their disease coming back, the rates there look really, really good as well. So at 24 months in a group of people who have been previously treated for CLL, about 80% have not had their disease come back. So overall, a really effective regimen. One thing that we do think a lot about when we're combining BTK inhibitors and Venetoclax is what does the side effect profile look like? How do people do when they're taking these medications? Is it causing too many side effects? And overall, it was pretty well tolerated. We look for something called dose-limiting toxicity, which is when these medicines are together, do they cause side effects that are so significant that people can't stay on them together? And we didn't see any of those dose-limiting toxicities in either the double or the triple combinations. With the double combination, the way the phase 1b study was set up, there was a month of Pirtobrutinib followed by the Venetoclax dose escalation. And with that, we did see a couple of instances where people had tumor lysis syndrome. So if you remember, tumor lysis syndrome is where the CLL cells basically pop open and they release all their gunk into the bloodstream. And in doing so, that can be hard on the kidneys and hard on the heart electricity. So we watch for that very closely because we know venetoclax is really good at popping open those cells, and we want to protect people from tumor lysis syndrome. So we did see two cases of tumor lysis syndrome in the doublet, and I'll talk a little bit more about how that plays into kind of what we're looking at moving forward. In the triplet combination, where people also got rituximab, there was no tumor lysis syndrome. And in general, people did well with this combination. There were some lower blood counts because of the combination, and 2 people in that arm of, in the 3 medicine arm did have to stop their medications, 1 because of low white blood count and 1 because of infections. So overall, the study gave us a really good look into a combination and treatment that we think is going to be very, very effective for CLL. And there's a phase 3 study that's actively enrolling right now. So it's recruiting people in to see how the combination of Pirtobrutinib with Venetoclax and Rituximab compares to the standard of care approach with Venetoclax and Rituximab, which is a FDA approved regimen for relapsed and refractory CLL. So excited to see how that study develops, and we are finding out kind of the best ways to treat CLL for people in all lines of therapy, but in this case specifically for those who have had their disease come back after prior treatments.
Wow, thank you for that excellent summary. It sounds like this combination is really exciting, and it also sounds like it's really effective. So if I understood you correctly, patients who were treated with the Pirtobrutinib and the Venetoclax were treated for a total of 2 years of therapy, and then they were able to stop therapy, and the disease, the CLL, remained in remission for at least 2 years, and you're expecting even longer remissions than that.
Exactly. So this is a fixed duration regimen, meaning that we're using the drugs by a calendar span. So this was 2 years of therapy and then people stopped. Exactly. And we're hoping that people have really long times after their treatment where they don't need any further therapy.
Wow. Are any of these fixed dose treatments in clinical practice right now?
Great question. So that phase 3 study that I was describing, the triplet combination versus the standard of care Venetoclax and Rituximab, that standard of care regimen is approved as 2 years of medicine and then you stop. So it's 6 months of Rituximab and a total of 2 years of Venetoclax, and that's a fixed duration therapy that is approved for the use of for the treatment of CLL that has come back, and one that we use in clinical practice.
Oh, great. So very nice trial design where you are comparing 2 fixed dose treatment regimens. And you said that this clinical trial is open, so it is available for patients if they want to enroll on this trial.
Exactly.
Wonderful.
Yeah.
In your experience for patients who are on this treatment for 2 years, you mentioned something about serious side effects, but for patients who are receiving this therapy for 2 years, in general, how did they feel while they were on it?
So I think these drug combinations tend to be fairly well tolerated, meaning that the overall people feel pretty good on these combinations. One advantage of the fixed duration approach, meaning, you have medicine for a certain amount of time and then you stop, is that some of the side effects that we see with medications do tend to accumulate over time. And by limiting how long people are on these medicines, we hope that we're able to really treat people effectively for a short period of time and then have them have a period where they're not having any of the side effects associated with medicines. I think we all kind of can appreciate that even the best tolerated medicines are not better than no medicine at all. So if we're able to get people off and have them have these periods where they're not taking any medications, we're hopeful that overall that really helps people live very well with feeling really good.
Thank you. I really appreciate you being here with us today, Dr. Roeker, and I also really appreciate all of the work that you're doing researching new medications in your care of patients with CLL.
Thank you so much for having me. Really great to see you.